of the following is not commonly seen in a child with cystic fibrosis? Correct answer is option B, hyperkalemia. Children with cystic fibrosis often have high spit chloride levels and salt loss, which can cause contraction alkalosis. Hyperkalemia is not a typical feature. A newborn has persistent jaundice beyond 3 weeks. The bilirubin level decreases after treatment with phenobarbital. What is the most likely diagnosis? Here the right answer is option D, Crigler-Najjar type 2. It causes unconjugated hyperbilirubinemia and responds to phenobarbital therapy, which helps lower bilirubin levels. A patient with acute myeloid leukemia is planned for an allogenic stem cell transplant. Which donor would be the best choice? The right answer here is option D, HLA identical healthy brother. A matched sibling donor is the preferred donor for allogenic stem cell transplantation because it offers the best compatibility and outcomes. Nasal polyps are most commonly associated with which type of asthma? The right answer is option C, intrinsic asthma. Nasal polyps are commonly associated with non-allergic asthma and are often seen as part of aspirin-exacerbated respiratory disease. Which of the following best describes decorticate rigidity? The right answer is option A. It is characterized by flexion of the upper limbs and extension of the lower limbs. Decorticate rigidity occurs due to the lesions above the red nucleus and produces the classic arm flexed, leg extended posture. According to the myogenic mechanism of renal autoregulation, afferent arterioles contract in response to stretch due to The right answer is option C, opening of calcium channels. When the afferent arteriole is stretched by increased blood pressure, calcium enters the smooth muscle cells causing vasoconstriction and helping maintain a constant renal blood flow. Which of the following is not a risk factor for developing delusional disorder? The right answer is option B, young age. Delusional disorder typically occurs in middle or later life, while factors such as social isolation, recent immigration, and family history can increase the risk. Which of the following drugs is commonly used to help people quit smoking? The right answer is option A, varenicline. It helps reduce nicotine cravings and withdrawal symptoms by partially stimulating nicotine receptors in the brain, making it easier to stop smoking. What is meant by a degloving injury? The right answer is option C, skin and subcutaneous fat are stripped from the underlying fascia. Degloving injuries usually occur due to severe trauma, causing the skin and soft tissue to separate from the deeper structures. Which of the following fractures has the highest risk of non-union? The right answer here is option C, proximal scaphoid fracture. The proximal part of the scaphoid bone has a poor blood supply, making it more prone to delayed healing and non-union.